clock drawing at least became very popular in the early 1980s, and it was, despite my talking about neuropsychology, done by a neuropsychologist at the Boston VA named Edith Kaplan. You may be familiar with her name because she was involved with the development of the Boston Diagnostic Aphasia Examination. The cookie theft card is part of the NIH stroke scale characterization. She had both a command, which is the standard clock drawing, and a copy version that kind of helped tease out some of the conceptual versus perceptual aspects when you have a bad clock draw. A number of times have been used to set the hands or to set the time of the clock. We have popular 10 minutes past 11 and 20 minutes to 4. And these are important because you take a look, both of these times involve both hemifields. And there's a little bit of confusion with respect to the difference between the number that designate the hour and the minute placement. I started actually with 20 minutes to 4, and over time have switched to 10 past 11 as kind of a preferred approach. Also, when I give the instructions, and I give it outside the context of the slums or the MOOC or anything else, I use that as a screening test that I can personally observe as part of my clinical interview. I give the instructions 3 parts. First, I ask them to draw a circle. Then I ask them to start numbering, but start with number 12 at the top, and then go around 1, 2, 3, 4, 5, and so on, and then set the time to 10 past 11. And the reason that this is important to me is other approaches, a person will probably start with the circle, then start 12, 3, 6, and 9. And what this does is it provides an anchor to the patient that can compensate in part for some poor planning that I want to test with the clock, so they can go back and then fill in the numbers. And it decreases the likelihood that I'm going to find information that is clinically meaningful. So I try to keep them from using these anchors or the corners of 12, 3, 6, and 9.